With the breast lift procedure, how does a woman know before she even comes in if she needs a lift or not?
Well, before she comes in,
Yes.
if she looks in the mirror and feels that her breast glandular tissue is sitting on her chest, or she thinks her nipple is too low on her breast mound, it's worth considering. The only way to know if she needs a lift and what type of lift to do, she needs to see her plastic surgeon.
So if she comes in and you tell her she needs a lift, what are the different types of incisions that are available?
Well, let me back up on that a little bit. Most women who come in for a breast lift want firmer breast and often larger breast. So they will get an implant. Once they have an implant in, then at the same time, there are a number of kinds of lifts to be done. One is just a little crescent-shaped incision above the areola to lift the nipple less than an inch. Another one is an incision that goes completely around the areola. It's an internal purse string. And when that is tied, it can lift the breast about an inch to an inch and a half. It rounds out the breast. Another type of lift where the nipple needs to be raised more is a lollipop type of incision. It goes around the areola and down the front of the breast. And someone who has really long breasts, something really drooped, there's an anchor-shaped incision. It goes around the areola, down the front of the breast, and in the crease on the underside of the breast. It's often only an inch or two, but sometimes could be the whole width of the breast, depending on how much drop the woman has.
So how much lift do you get with each of these incisions?
Well, with the little crescent shaped under an inch, less than an inch I should say, the one that goes around the areola, an inch, inch and a half. The kind that's the lollipop lift, 2-3 inches. If it's 3 inches or more, I'd say it'd be an anchor-shaped incision.
So when you do the lift, is it common to lose volume also?
Depends on the lift. The first two, the more minor of the two, the incision above the areola or the circumareolar or around the areolar incision, lose just a little bit of skin, not a significant volume. When you go to the lollipop one, where the incision's down the front of the breast, or the anchor-shaped one, there's usually half a bra cup size, maybe a full bra cup size loss of incision, of breast volume.
So if a woman has children, a couple children, is breastfed, comes in, she needs a lift, will that alone take her back to her pre-pregnancy size?
Assuming she's her pre-pregnancy weight, the answer is no. That's why a lot of women would like to have a breast implant put in at the same time.
Is that done at the same
Done
surgery?
at the same time.
And then, I guess what size implant they choose depends upon how much volume or what look that they'll have after surgery.
Yeah, in their internal body image. Some women want to be dramatically larger, some only return to their original volume. So it depends.
And how long is the procedure? Is it outpatient?
It's outpatient. How long it takes really depends on which of the uplifts we do. The little crescent-shaped uplift adds a little bit of time to the operation. This one where we go completely around the areola probably adds half an hour or so. The one where we do the more extensive uplift can add an hour or hour and a half to the procedure.
So is this a long recovery?
No, it adds virtually nothing to the recovery of somebody that's having a breast enlargement. The only thing that adds to the recovery is if someone has the more extensive uplift. I don't want them doing things where their breasts bounce or get crushed for 6 weeks. So if they're playing volleyball, no, for 6 weeks.
So someone that just has a breast lift, they don't have the augmentation, what's the difference that they're going to see after surgery?
They'll see the position of the nipple and areola complex be higher on their breast mount. I think the breast will be firmer. Now, if this is a 23-year-old woman, it'll be very firm and youthful. If it's a 53-year-old woman, it's not going to be as youthful looking as the 23-year-old. Some women have very large areola. We also bring those down in size to an average size.
So women that come in and have a breast lift, what's usually their reason for doing that?
They want to look better. They want to look more youthful. In our culture, a breast that has drop to it is considered not as attractive as a breast that doesn't have any drop. So it's a cultural reason for doing it.